Good afternoon, everyone. Thank you for joining us today. The time is now 1:07 p.m. by my clock, and I am calling this meeting to order. Ms. Hogan, can you please read the notice of the public meeting?
Madam Chairwoman, this is a meeting of the New Jersey Cannabis Regulatory Commission. Adequate notice of this meeting has been provided in accordance with the Senator Byron M. Baer Open Public Meetings Act. The meeting was noticed in the Asbury Park Press, Atlantic City Express, Bergen Record, Career Post, and the Trenton Times in April 2021. Information regarding the virtual nature of this meeting due to the COVID-19 pandemic was posted in publications and on the CRC website. The meeting time and location has also been posted on the website of the New Jersey Cannabis Regulatory Commission and with the Office of the Secretary of State.
Thank you, Ms. Hogan. Can you please take roll call?
Commissioner Barker? Commissioner Barker, I think you're on mute. I will move on to Commissioner Del Cid Coso, and then we'll circle back.
Present.
Vice Chair Delgado?
Present.
Commissioner Nash?
Present.
Commissioner Barker? It seems we might be having some technical difficulty with Commissioner Barker. Chairwoman Wainu?
Present. Oh, there we go. Commissioner Barker, we can hear. I think we were able to hear him for just a second. We will give it one moment to see if we can get Commissioner Barker's sound operational before we get started.
Can everybody hear me now?
Yes.
Yes.
Okay.
Commissioner
Thank you for your
Barker?
patience. Present.
Awesome. Thank you. All members of the commission are present and we now have a quorum. The first order of business is for the commission to go into executive session to discuss legal matters and litigation updates. These are discussions that are not shared with the public. We believe the executive session should take about 30 minutes.
Thank you. Do I have a motion to go into executive session?
Madam Chairwoman, I move that we go into executive session.
Second.
So moved by Vice Chair Delgado, seconded by Commissioner Del Cid Coso. Is there any discussion on this motion to go into executive session? Hearing none, all those in favor say aye.
Aye.
Aye. All those opposed say nay. Any abstentions? All right, hearing none, we will adjourn for executive session. Again, for our members of the public watching, we expect this to take about 30 minutes. So right now we can expect to resume the public portion of our meeting around 1:40 p.m. Thank you so much. All right, we are back. Thank you everyone for your patience. The time is, our executive session has ended. Time is now 1:41 by my clock, and we will resume the open public portion of this meeting. Ms. Hogan, can you please announce the next agenda item?
Absolutely. And before I do so, I just want to note for the record that I made a mistake. The meeting was noticed in December 2021 and not April 2021. Okay. The next item on today's agenda is approving the minutes of both the Commission's open session and executive session held on January 7th, 2022. The minutes have been shared and reviewed by the members of the Commission prior to the meeting.
Thank you. If there are no questions related to the meeting minutes, I'll ask for a motion to adopt the meeting minutes for January 7th, 2022.
Madam Chairwoman, I move to adopt the meeting minutes from January 7th, 2022.
I second it.
All right, moved by Commissioner Barker, seconded by Vice Chair Delgado. Is there any discussion on the matter? Hearing none, all those in favor of approving the January 7th meeting minutes, say aye.
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 All those opposed, say nay. Are there any abstentions? The ayes have it, and the motion is carried.
The next item on today's agenda is the chair's report.
Thank you, and thank you and welcome to everyone who is joining us virtually today. Just a couple of updates for everyone. Some of the public comments that we had received at the last public meeting, I just want to note, acknowledge them and provide some quick responses to some of the items, the themes that were raised, including the question of whether towns can opt out of having micro businesses and how applicants can understand whether any previous criminal convictions could impact their application or their eligibility for a cannabis license. I know some folks had questions about funding, and so we try to have staff follow up on some of those individualized questions. But for items that are more general, we encourage everybody to go to the CRC's website, go to our page with the frequently asked questions. A lot of information is available online, and that information covers, what towns can opt out of and how towns have to opt out, or how they might be opting in to allowing cannabis businesses in their jurisdictions. And it also spells out our frequently asked questions and our guidance materials and our webinars that are recorded and posted on our website do provide a wealth of information for applicants so that they all know what to expect when they're pulling together their application materials and how they can walk through the application portal and be supported if they encounter any issues. Secondly, I want to note that the CRC has heard from a number of community groups wishing to support applicants for a permit or license from the CRC. To reiterate the process for application review, which Director Brown has previously explained in detail in some of our prior meeting minutes, in some of our prior public meetings, where there is a competitive request for applications process, the CRC is bound to consider any applicable statutes, the terms of the RFA, and the information that is provided with an application properly submitted to the Commission. External documentation of community support, where not provided with an application being submitted, are not considered in the application review process. I hope that by reiterating the regulatory review process, we can help ensure that previous and prospective applicants and the public all understand how the CRC's work serves our New Jersey community. And lastly, I'll note that there has been a change in our agenda for today. So we initially had planned for a report out from our Public Reporting and Education Committee. That is being pulled for today. The details of that report out won't be provided today. We'll look to provide that information later. However, I'll note that the CRC is actively working to plan for public hearings to solicit input from the community about what investments in communities should be raised and elevated at the state level. So we have our committee members who are working on planning for those public hearings, and so more details will be forthcoming. We encourage everyone to keep eyes on the website and on our social media accounts for more information once those details are locked in. And that is all that we have today for our chair's report.
The next item on today's agenda is the Executive Director's Report.
May I have the floor, Madam Chair?
Please, Director Brown.
Thank you. Today, members of the commission, Madam Chair, for the Executive Director's Report, going to cover cultivator and manufacturer applications and broadly application acceptance, an update on the awards from the 2019 RFA, an update on expanded ATC certifications, and then I will be turning it over to our Communications Director, Tony Ann Blake, to provide the commission and members of the public with an update on an important public information campaign that the commission is launching. Next slide, please. So as you all know, on December 15th, 2021 at 9 a.m., we started taking applications for cultivators, manufacturers, testing laboratories. We launched a new application system, and that system has been consistently operational over the last month and has been accepting applications, with the exception of a few, couple minute sections here and there where there was some scheduled off-hour site maintenance. As of today, 336 total applications have been received and are moving through the review process. Over 1,800 user accounts have been created. Next slide, please. Looking at the application types, the vast majority of those applications are applications for conditional licenses. We're now up to about 87%. It's consistent with last month's meeting. Our last meeting on January 7th, about 13% are for annual licenses. Next slide, please. So the breakdown in application types, a little under 2/3 of those applications are for cultivation. About 1/3 are for manufacturers. Just under 1% are for testing laboratories, and we have just under 3% other. Those are actually license applications that we are not accepting at this time. Those will have to be rejected back to the applicants who submitted them. The others will move through the review process as we've outlined before, particularly in our pre-application webinar. Next slide, please. The breakdown is consistent with my report from the last meeting. We have 115 total social equity business applications, 154 total diversely owned business applications, 34 impact zone applications, 8 applications asserting they can qualify for bonus points. And then we have 15 applications that just fall into the general pool and don't assert that they qualify for any of the other designations. Importantly, these are what the applicants have self-designated. These have not been fully vetted as a whole cohort, but this is what the applicants have self-designated. Next slide, please. And I'll note that before I get to the 2019 RFA awards update, one important thing to reemphasize that I did mention in the pre-application webinar is that our goal is to get to a 90-day review turnaround when it comes to license applications. But given the volume and given the fact that we are a new agency still staffing up, it is unlikely that we're going to hit that 90-day turnaround in the early days. But our goal is to get these moved and get them reviewed and approved as quickly as possible, and get them before this body for approval, and so that we can move these businesses through the stages to get to the market. Looking to the 2019 RFA awards, which were done in 2 stages at the end of 2021, we have 4 vertically integrated awardees and 10 cultivation awardees. Previous slide, please. There they are. Those awardees, the 14 of them, are still in the investigatory stage of permitting. They're we're verifying the information supplied in the application, verifying the data we got back from criminal history background checks, and then verification of compliance with conditions in the final agency decisions that the commission approved. Next slide, please. For dispensary awardees, like cultivation and vertical, they had 5 business days to accept the award. They then, by January 6, 2022, needed to submit proof of site control, proof of municipal approval, and proof of if they asserted they could get a minority business enterprise, women-owned business enterprise, or veteran-owned business enterprise certification, they had to supply proof of that. I can tell you that those are moving into the investigatory stage. So letters went out to the applicants that are actually yesterday, noting what they have to provide. Those are criminal history background checks, documents to help verify what's in their applications, and the similar process I just outlined for cultivation and verticals. I will note that per the FADs, cultivation and vertically integrated awardees have 18 months from the time of award to get operational, and dispensaries have 12 months from the time of award to get operational. Thank you. Next slide. So moving to expanded ATC certifications, this is the process outside of our normal application process by which alternative treatment centers can assert a number of things. Number one, that they have approval from their municipality, and their municipality is opted into recreational sales. Number two, that they have enough supply to not only supply their patient base, but also supply additional recreational consumers. And number three, that they have the operational capacity and they have plans to continue to prioritize patient access and ensure there is no reduction in patient access, even if recreational sales are approved. So to date, we've received 8 of these certifications. So that's up from my last report out on this. And you can go to the next slide, please. These certifications also include our ask in guidance, which required ATCs to submit plans and firm commitments to addressing our core values of equity and safety. So the process for approval of these, we review the certification submissions for completeness. Then we'll move on to, if they pass the completeness review, then move on to the substantive review of supply and operational capacity to expand. That pursuant to our regulations includes both an ATC specific and more of a market based assessment, a review of those plans and commitments to equity and safety. Then if recommended by staff, it would then go to the commission for a vote to approve or deny that certification. And then if improved, they would need to be inspected to ensure compliance with the full range of regulations that were adopted in August of 2021. Next slide, please. So I want to stop here for a second because we have 8 submissions now, and we're constantly getting more materials added to these submissions. And I know some has come in this week, some came in last week, but as of the last review that I did and that staff assisted me with, none of the ones we received were complete. Now, like I said, we have received new materials, so that we might, with those new materials, that might change. But it's important to note because what we're asking for as part of these certifications should not be new information. In fact, a law was signed in February 22nd, 2021, which included the required statutory factors, of which one is municipal approval. The other is that supply and operational capacity. Then on August 19th, 2021, the commission voted to adopt regulations, which outlined exactly what we needed to see in the expanded ATC certifications. And again, this included municipal approval and supply and operational capacity, among a number of other things that we've required in applications for alternative treatment centers or other businesses for quite a while. Next slide, please. And then additionally, we issued guidance to the alternative treatment centers on November 23rd, 2021, which included, again, a reiteration of the requirements that are in the law that was signed on February 22nd, 2021, and a reiteration of those same requirements that are in our regulations that were adopted on August 18th or August 19th, 2021, which again included municipal approval and supply and operational capacity. Next slide, please. So again, 8 certifications have been received by the commission and are under review. The initial round of completeness review is done for the most part. Again, we have gotten new materials, so initial feedback is going to ATCs. For the ATCs listening, if you haven't got it already, you'll get it before the end of the week. For the most part, we see major deficiencies in these certifications. And the one that pops up over and over and over again, and that by far is the most prevalent, is a lack of municipal approval. And in fact, the ATC with the most supply in the entire state has not submitted a single municipal approval. And this is the same ATC that in an article today is saying publicly that we need to know what to do. It's on the state's plate. In fact, I notified this ATC last week exactly what they needed to submit, which was municipal approval for any of their sites, and we have none. And this is, it's not only this one ATC, it's consistent with other alternative treatment centers as well. Now, that's not to say we haven't gotten some submissions that look promising and that are being amended and could possibly be compliant if they aren't already. But you know, I note this because there's a level of frustration here at the commission, certainly with me, certainly with staff and others, that, you know, there's an effort to pressure us to move forward in a way that's not compliant with the law. And that's just simply not going to happen. The law has been in place since February 22nd, 2021. It has noted clearly that alternative treatment centers need three things: municipal approval. They need the relevant supply, necessary supply to be able to continue to serve their patient base, operational capacity to be able to continue to serve their patients, and even expand access while we add recreational consumers to the mix. So these are not new things. They have been in the law since it was signed. They are in our regs. They are in guidance. We reiterated them on a call with the entire industry. So they should not be new. And you know, so that's where we are with this. And you can go to the next slide, please. So I wanted to reiterate some things that we are serious about here at the commission. Compliance with the law that has been in effect since February. And this includes primarily the three factors that I just went over several times. We are serious about maintaining and improving supply for patients. That means that we want to see that ATCs are expanding access, that they are actively you know, bringing online capacity to serve recreational consumers. And to be honest, looking at supply, which we do frequently, there are some that have done that, but they haven't put together the whole package, which again are those statutory requirements that have been in place since February 22nd, 2021. We're also serious about maintaining and improving access for patients. And this is one where we're going to have to do some guidance, because I've read the certifications and just you know, and this isn't true across the board, but there's a lack of specificity of measures to ensure that patients will continue to have adequate access to dispensaries once we turn on recreational sales. When we turn on recreational sales and there are limited outlets to get recreational cannabis, they are going to be crowded. And we want to see specific measures to ensure that patients continue to be served first and see no decrease in access whatsoever. And then lastly, equity and safety. These are our core values. We're serious about both. So with that, we'll be getting back to all of the alternative treatment centers that have submitted certifications with exactly what needs to happen. Some we already have, and in fact, the ones that are being most vocal know exactly what they need to do. So thank you, and I will turn it over now to our wonderful Director of Communications, Tony Ann Blake, who's going to brief the Commission as well as the public on an important public information campaign that we are in the midst of launching.
Thank you, Director Brown. In our ongoing efforts to foster a cannabis industry that reflects New Jersey by diversity and also in the variety of businesses, we want to make sure that everybody knows about the opportunities for starting a business, meaning applying for a license and for being employed in the cannabis industry. So we are launching in a few days our public information campaign. Some of the images are on your screen right now, and you will be seeing these on bulletin boards, bus panels, bus shelters, digital ads, all across the states, because we want to make sure there isn't a corner where people are unaware of the opportunities that exist as we grow this industry from scratch. Thank you. Commissioner Wagner.
Thank you, Director Brown and Communications Director Blake. Director Brown, I want to thank you particularly for the detailed report on the certifications that have been submitted thus far. If true, those deficiencies, those major deficiencies are troubling. And we at the commission certainly want to prioritize ensuring that patients continue to be served first and that they have necessary access to their medicine. I'm very happy to hear that staff are being vigilant about adhering to the law and making sure that anybody who operates in the cannabis industry in New Jersey, be it medicinal or otherwise, is held to account and is doing the right thing for our patients and our broader New Jersey community. With that, Ms. Hogan, can you please announce the next agenda item?
Next up on the agenda is the consideration of adoption of Cannabis Regulatory Commission bylaws.
Thank you. I have asked our bylaws committee to provide a summary of the bylaws that are up for adoption for the public to understand how these bylaws will govern the commission's operations. So I'll turn it over to our bylaws committee members.
Thank you, Madam Chair. Well, first of all, thank you for allowing this committee to be able to present today. Before we dive into the PowerPoint that we have for the public, I just want to point out that these bylaws will be available to you on our website. If they're not already up, they will be available to you after this meeting. Overall, the document has 11 articles, about 14 pages. They cover areas from composition of the commission, terms of office, compensation, the role of the chair, the vice chair, and the executive director, and more. But for the sake of time, this quick overview just highlights some of the key points of the bylaws. On that note, Ms. Blakey, we can turn to slide 4. My apologies. Can we go back to the first one? Thanks. The next one. Thank you. So the purpose and scope, as you know, the CRC is established in, but not of, the Department of Treasury. The commission is to comply with all applicable laws, including but not limited to the Jake Honig law that was signed in 2019, the New Jersey CREAM Act that was signed in 2021, the State Agency Transfer Act, the New Jersey Employee Relations Act, and the Senator Byron M. Baer Open Public Meetings Act. Next one. Power, duties, and functions. The CRC assumed responsibility from the Department of Health for the further development and expansion, regulation, and enforcement of activities associated with the medicinal use of cannabis pursuant to the Jake Honig laws. In addition to that, the CRC oversees the development, regulation, and enforcement of activities associated with the personal use of cannabis pursuant to the CREAM Act. Next one. Roles and responsibilities. So the board shall serve as a governing body of the commission responsible for issuing final agency decisions, adopting regulatory policies, and ensuring the commission operates in accordance with sound fiscal principles and with the highest ethical standards. The board is also in charge with the following responsibilities: establish regulatory policies for the commission by promulgating rules and regulations, cooperated with commission staff, and act on any matter duly before the commission in accordance with the law. Next one. The plan of organization. So the commission should establish, and from time to time we can amend that, a plan of organization and employ personnel as it deems necessary. The plan of organization should include the Office of Minority, Disabled Veterans, and Women in Cannabis Business Development established by Section 32 of the Jake Honig law. And the commission, as you know, has adopted a resolution, and that's Resolution 2021-4, the establishment of a plan of organization on April 12th of 2021. And with that, I'm going to hand it over to my partner, Commissioner Delgado.
Thank you, Commissioner Delstead. Thank you. And I just want to reiterate again that the bylaws will be available, if they're not already so, on our Cannabis Regulatory Commission website. So let's go on to the next slide, delegation of authority. So the key point here is that the commission retains the authority to designate itself or other staff members of the commission to perform functions in a particular case or as circumstances require. Any delegation of authority by the commission shall be effected through the adoption of a formal resolution. I think you've seen that in previous hearings where we've done that at a public meeting. Such resolutions shall specify the following without limitations. Number one, specific authority delegated. Two, the staff member or staff members to whom such authority is delegated to. And three, any limitations or conditions imposed on the authority delegated. Next slide, please. Meetings of the commission. The key points here are, we've already met one of the key points, and that is that we've already published the regular meeting schedule before January 10th. And again, those meeting schedules, you can go to our website and review those meeting schedules and the times. All commission members will be or shall be notified in writing by the chair or vice chair not less than 24 hours in advance of the special meetings and notice. And all meetings of the commission shall follow the Senator Byron M. Bayer Open Public Meetings Act. And those are the key points that I wanted to point out on the meetings of the, commission. Next slide, please. The commission, the committees on commissions, well, the commissions have four permanent standing committees as set forth in section 5.02. They are the audit committee. The audit committee is responsible for the review and monitoring of the commission's financial statements and the adequacy of its financial controls, also the results of any audit and compliance with all legal, regulatory, and ethical requirements. The second standing committee is the Public Engagement and Education Committee, and that will be responsible for reviewing and approving public awareness campaigns that are required full consideration by the commission. The Public Engagement and Education Committee will also organizes any public hearings required by statute to communicate with the public regarding recommendation for the appropriation of social equity exercise revenues. And three, the third committee is the Product Safety and Packaging Labeling Committee. And that committee is responsible for monitoring complaints from patients and consumers to identify any trends or patterns in product safety concern. And finally, the fourth standing committee is the Permitting / Licensing Committee that will evaluate the regulations promulgated by the commission for permitting, licensing, or alternative treatment centers and cannabis business to ensure that those licenses and processes, permitting processes are efficient. And that concludes the report. Madam Chairwoman, again, I want to emphasize that these bylaws, if anybody is interested, they will be available on our website. Thank you.
Thank you, Vice Chair Delgado and Commissioner Del Cid Coso for a summary of our bylaws. Do I hear a motion from any of our commission members on this item?
I move to approve.
So moved by Commissioner Nash. Is there a second?
Second.
Seconded by Commissioner Del Cid Coso. Is there any discussion on the adoption of the bylaws? Hearing no discussion, Ms. Hogan, can you please call the vote?
Commissioner Barker,
Nay.
Commissioner Del Cid Coso,
Yes.
Vice Chair Delgado,
Yes.
Commissioner Nash,
Yes.
Chairwoman Waynu.
Yes.
The motion passes. Next on the agenda is the consideration of amendments to the CRC's interim lab testing standards.
Thank you. Director Brown, can you please provide a summary of the amendments and the need for the amendments up for consideration?
Absolutely. Thank you, Madam Chair. So on June 1st, 2021, the commission adopted pursuant to Jake Honig's law, interim lab testing standards for medical cannabis alternative treatment centers. The statute gave the commission the ability to, in advance of the commission's own regulations for testing in medical cannabis to designate interim standards by essentially adopting another state's regulations. The commission adopted Maryland's regulations and the corresponding technical guidance. So those are some of the most comprehensive standards in the country for medical cannabis. Since that adoption, there's been some back and forth, and have certainly heard feedback from alternative treatment centers in the industry about some of the challenges with operationalizing those standards as drafted for Maryland, which is a very mature, third-party testing state versus New Jersey, where it's an industry that's just getting off the ground. And so one of the big challenges has been around the batch sizes. So the Maryland standards require a 10-pound batch size. So this amendment would just offer some flexibility on batch sizes, but do so in accordance with the standards previously adopted by the commission. So the resolution before you simply allows for batch sizes to be designated up to 100 pounds, but provided that samples are taken in accordance with the technical guidance in the Maryland standards and in accordance with the total weight required by the Maryland standards. So what that means is for the Maryland standards, and for the interim standards adopted by the commission, a 10-pound batch requires 10 samples, representing 0.5% of the total batch weight. So here, with this amendment, following that same exact rubric in the interim standards, a 100-pound batch would require 100 samples representing 0.5% weight. So in essence, this amendment just allows the batch sizes to go up to 100 pounds, but keeps that sampling percentage as well as number of samples consistent with the standards formally adopted by the commission. In my estimation, this will help to get more alternative treatment centers to choose third-party laboratories and begin to test under the interim standards, which provides for a wider range of testing than our state lab can do. So it will ultimately help more alternative treatment centers take us up on this option, help more products get tested more frequently, and also provide the industry with the flexibility it needs to implement third-party testing in the state of New Jersey.
Thank you, Director Brown. Do I hear a motion on this item?
Madam Chair, I move to adopt this resolution concerning the amendments to CRC's interim labs testing standards.
Moved by Commissioner Del Cid.
I second it, Madam Chairwoman.
Seconded by by Vice Chair Delgado. Apologies for that. Is there any discussion on this matter? Hearing no discussion, Ms. Hogan, can you please call the vote?
Commissioner Barker,
Aye.
Commissioner Del Cid Coso,
Yes.
Vice Chair Delgado,
Yes.
Commissioner Nash. Commissioner Nash,
Yes.
thank you. Chairwoman Waynu,
Yes.
the resolution is approved. Next, we have the open public comment period.
Thank you. Again, members of the public can submit comments to the CRC during and after this meeting in writing via our website, nj.gov/cannabis/meetings. The deadline for submitting written comments to the commission is 5 p.m. tomorrow, Friday, January 28th. Written comments will be shared with the commission members and will be made public along with the meeting minutes. We will hear from those individuals who have signed up to speak in the order in which they signed up. Speakers during this afternoon's public comment period will be limited to 3 minutes. Please be mindful and concise during your comments. And also please note that the public comment period is meant to give members of the public an opportunity to address the commission about matters that the commission should be aware of. It's not a space for individuals to simply market or advertise private businesses. So please keep remarks focused on matters that pertains to the commission's work or items that the commission should be aware of. Ms. Blake will call out the names of our speakers. When it is your turn to speak, Ms. Blake will ask you to unmute yourself. I don't believe we have anybody joining by phone, but if you are joining us by phone, you will have to press *6 to unmute yourself when told to do so. Now, in order for our staff to unmute individuals who signed up to speak, your full name or your phone number as it appears on Zoom must match the name or phone number you used to register to speak. So please ensure that your name matches the name you used to sign up. If you need to change your name on the Zoom platform, we suggest that you exit the Zoom meeting and immediately relaunch the Zoom meeting, which should prompt you to enter your name. If you are joining us by phone, the phone from which you are calling must match the phone number that was used to sign up. We will not be able to correctly identify you if you are a speaker, if your name or phone number does not match what was used to sign up. So I know we have several Dans, several Daves and Davids here. So please make sure that your name is correctly displayed on the Zoom platform. Now, one last note before I turn it over to Ms. Blake to call up our first speakers is if you have a question about a general question about the commission's rules or about what you need, what material or information is needed to submit a permit or license application to the commission, please, please, please go to our website, nj.gov/cannabis. On that page, you'll see a resources tab that has several FAQs. You'll have full information to and full access to the webinars that the commission has hosted. And under our cannabis businesses tab, you'll see a wealth of information about what is required to submit an application to the commission. So please, please, please use our website as the wonderful resource that it is meant to be if you have general questions. With that, I'll turn it over to Ms. Blake to call up our first speakers.
Good afternoon again. So our first speaker of the afternoon, is Rick Robinson. Rick Robinson, Dr. Akin Awufalaju, Hassan Austin, David Fetter, and Sarah Ahrens. Rick Robinson, Dr. Akin Awufalaju, Hassan Austin, David Fetter, and Sarah Ahrens. Those are the first 5. If you are present, please raise your hand and I will call on you. I see Hassan Austin. Go ahead, unmute yourself and you may speak.
Yes, good afternoon. First off, I do want to start off by, just saying thanks again to the CRC for all of your hard work. I'm managing partner for MTN Biz Development. We work with a lot of the New Jersey municipalities on crafting strategy and programming that addresses and help realize social equity. So we see a little bit on the municipal level. We just wanted to share. So ultimately, if you ask 10 people, how would you define social equity? You're going to likely get 10 different answers. So it's a very complex and multi-layered problem, which requires simple multi-layered solutions. So these items tend to take time to reach resolution. So so people should really manage their expectation because there are a lot of moving parts. We encourage applicants, entrepreneurs, investors, and all stakeholders, just be smart, be patient, consider demonstrating your commitment to community reinvestment as you engage New Jersey municipalities for cannabis licensing. These social equity items, they have to play out. Some of which may play out with litigation, but they have to play out. And again, these are very complex and multi-layered items that we ultimately define what social equity is in that New Jersey municipality. So I say all this to say, please be diligent in your pursuit of a cannabis business license in New Jersey. Thanks. Thank you again.
Thank you, Mr. Austin. Our next speaker, I see Sarah Ahrens. Go ahead. Ms. Ahrens, go ahead.
Hi.
Mhm.
Thank you. Good afternoon, members of the New Jersey Cannabis Regulatory Commission and the public joining this meeting. My name is Sarah Ahrens, and I'm the founder and CEO of True Labs for Cannabis. We are one of the few analytical testing labs starting up in our state with our 5,000 square foot state-of-the-art laboratory in East Hanover, and we are the only certified woman-owned cannabis testing lab on the East Coast. I wanted to bring a new scientific organization to your attention today. A few months ago, under the New Jersey Cannabis Association, we formed the Laboratory Testing Committee. The committee is focused on assisting the New Jersey Cannabis Association's objective to ensure that decision makers and regulators understand and respect the needs of the cannabis community and that our community remains responsible corporate citizens. The Laboratory Testing Committee is dedicated to defining a consensus set of laboratory testing standards for New Jersey that ensure safe products to protect consumer and patient health. Our objective is to enable New Jersey Cannabis Regulatory Commission to quickly create and maintain robust cannabis testing industry by combining operational practicality with product safety, while maintaining the integrity of the testing market. Our committee members include the New Jersey Cannabis Association members who have relevant education and experience related to the physical and biological sciences, laboratory testing, medicine, public health, or similar. Currently, we have representation from 4 cannabis analytical testing laboratories starting up here in the state, as well as other scientific experts. I myself am the chair for the committee. We actively collaborate with experts and resources outside of the committee, including university experts and national standardizing organizations, to help contribute towards achieving the committee's goals. Given the vast amount of scientific expertise amongst the laboratory testing committee members, as well as with the network of experts we are collaborating with, we are assured to bring forward to the CRC scientifically sound and justified recommendations. On behalf of the Laboratory Testing Committee within the New Jersey Cannabis Association, we are looking forward to helping the Commission quickly create and maintain a robust cannabis testing program with best-in-class standards. Thank you.
Thank you. Rick Robinson, Dr. Akin Awafulujo, David Fetter. Are any of those 3 still present? I don't see those, so I'm going to move to the next 5. Daniel McCarthy, Patricia Gregory, Ryan Finn, Lincoln Grattan, Mike Thompson. Daniel McCarthy, Patricia Gregory, Ryan Finn, Lincoln Grattan, and Mike Thompson. If any of those individuals are present, please raise your hand. I see Dan McCarthy. Go ahead, sir.
Hi, this is Dan McCarthy. Thanks again, Commission, for allowing me to speak. My company, Megaleaf LLC, applied for a conditional micro business cultivation license as a social equity applicant and a minority-owned business. I have a few questions that I think some other applicants may share, not ones that are covered on your website. Based on my application number, it looks like I was the 3rd or 4th application in the state. And based on the type of applicant that I am, I would think I would be one of the first ones being reached out to. So I was hoping by this point I would have heard back either in an email or a phone call, but I understand you are very busy. But I just wanted to know if there's different milestones that the commission is waiting to hit before reaching out, or if there's any sort of approximate timeline that they could give us as guidance, whether that be when they're done with the ATC certifications or any other sort of milestone. I tried contacting the CRC through email and requesting a meeting with a CRC commissioner administrator, but I haven't gotten a response to either one. Once again, I understand you're all extremely busy and I can appreciate that. But if I could be reached out to us, I'm sure many other applicants are waiting to hear back just for updates on the timeline. For example, my landlord's asking me when I'd be able to sign my lease, and I know that you can't give exact dates, but the longer it goes on without us as applicants having information, it's going to jeopardize our ability to meet the requirements that the CRC is putting forth. And lastly, I wanted to ask about the review phase and the process. If you could give any guidance on if there will be some in-person meetings or phone calls or emails. I asked because I actually have an elderly family member in Kansas who's not doing well, and I'd like to visit them soon. But I'm worried that if I'm not in New Jersey when I am contacted by the CRC, that it might delay my application. Once again, I understand you're all very busy and I appreciate the work that you're doing. But if I could either have these questions answered in general on a webinar for everyone to hear, or if somebody could reach out to me, I would really appreciate it. I'm excited to get involved in this industry and I'm willing to adhere to all the guidelines and all the requirements that you're putting forth. But if there's any way that you could continue to reach out and give more updates, specific updates to applicants, especially ones that are looking to get started sooner than later, I would really appreciate it. But thanks again for letting me speak. And I'm looking forward to the next steps of this application process.
Thank you for your comments. Next up will be Pat Gregory. Pat Gregory, go ahead.
Hello, can you hear me?
We can hear you. Go right ahead.
Good afternoon, Chairwoman Waynu, members of the CRC, and Director Brown. I am Patricia Gregory, one of the founders and president of Guadco 2 LLC. We are a 2019 RFA dispensary applicant. We were denied a permit in the central region due to only receiving 1 out of 30 points for WBE status. We are, in fact, a woman-owned and woman-operated business with extensive operational experience of medical cannabis dispensaries. In addition to myself, our chief operating officer and sole manager of the applicant is Joan Guadagnino. For over 3 years, Joan was also the COO of our Pennsylvania affiliate, which was the first medical dispensary approved for operations in Pennsylvania. We subsequently opened and operated 2 additional dispensaries, all 3 in the Northeast region of Pennsylvania. Our 2019 application included attestations to this experience, as well as evidence that myself, Joan, and my sister, a longtime New Jersey resident and investor, owned almost 54% of the applicant. What we did not submit was a New Jersey Treasury WBE certification because we were a newly formed entity without any revenue at the time. The dispensary application instructions provided that if a Treasury WBE certificate was not submitted, partial credit would be awarded based on the strength of the evidence that the Treasury's WBE criteria would be satisfied in the future once the applicant was revenue producing. In view of the evidence contained in our application, and that only 1, 25, or 30 points were awarded for the WBE criterion, we respectfully request that you reconsider Guadco 2's WBE score and award 25 points. We will be submitting this request in writing either today or tomorrow, and we ask that it be granted to correct the commission's error and avoid a long and costly appeal process. One other comment. As woman operators, Joan and I would be happy to have an offline conversation with the commission to discuss ways to avoid gaming the WBE process. Thank you all for your time and for what you do for the medical program.
Thank you for your comment. Ryan Finn, Lincoln Gratton, Mike Thompson, are any of those present, those people present? Okay. Not seeing any of those raising hands, I will move on. Kaylin McGinnis, Mallory Hagan, Emilio Barrena, Perry Bird, and Mark Conoscenti. Kaylin McGinnis, Mallory Hagan, Emilio Barrena, Perry Bird, Mark Conoscenti. I see Perry Bird. You may go ahead, sir.
Hello. Yes, I am a Zenleaf employee and on the union bargaining committee. I would like to thank you, the commission, for standing behind workers recently and allowing for us to continue and to proceed with taking tips. It was a big win for a lot of the dispensary workers, and the patients and workers there applaud you greatly for that. I just wanted to share my thanks with you all on that today. Have a wonderful day.
Thank you. Kaylin McGinnis, Mallory Hagan, Emilio Barrena, Mark Cosenti. Not seeing any of those, I will continue. Satyam Vakil, William Phillips, Jana Williams, Carl Christensen, and Sam Fareno. I see Carl Christensen. Go ahead.
Hello, thank you for your time. My name is Dr. Carl Christensen. I'm the Chief Science Officer for True Labs for Cannabis. I have a quick statement about the alteration to the interim testing standards communicated today. The idea of collecting samples is that there should be a representative sample. The change that has been made to expand batch sizing to 100 pounds may alleviate the need for ATCs to pay for so much testing and minimize the volume of samples needed to be run by third-party labs, but still requires the labs collect all of the samples they would have otherwise, though now the labs can only realize 10% of the compliance samples. In addition, the amount of material that will be utilized for those tests will only be a fraction of the amount submitted, and the data will not be representative of the entire batch. This is a terrible change and should be changed back to the original batch definition, or a compromise should be reached that does not undermine the validity of the testing results and compromise the point of testing in the first place to ensure a safe market for patients and consumers. There are models to reflect representative sample sizes, and an arbitrary change to 10 to 100 pounds is not the correct way to address the issue of batch sizing. Thank you for your time.
Thank you. And I see Jana Williams. Jana, go ahead.
Good afternoon, everyone. My name is Jana Williams. I'm a disabled veteran. I just wanted to come before the commission today and let them know I appreciate them taking their time and putting in the bylaws and just giving individuals like me the opportunity, the minority groups, being a woman and just being a veteran, the opportunity to participate in the cannabis industry. I just wanted to let you guys know that I really appreciate it and thank you.
Ms. Blake, can you please call the next speakers?
My apologies, I didn't realize I was muted. Satyam Vakil, William Phillips, Sam Fareno are the leftovers from that last batch. Not seeing any of those, I will move on. Chris Ware, Kim Hess, Mike DeMann, Shirali Patel, and Cheryl Murray Powell. If any of those individuals are present, please raise your hand. I see Kim Hess. Go ahead. Kim Hess, you may speak.
Pardon me, I didn't unmute. Could you hear me?
Yes, we can hear you. Yes, we can hear you.
Good afternoon. I'd like to thank the commission for the opportunity to speak today. My first question is there formal guidance set for all fees municipalities can charge cannabis businesses? If not, can it be expected in the future, or will the regulatory fee schedule be the only guide? My second question is, does the CRC have a general guide for the municipal applications? Thank you for your time.
Thank you. I see Chirali Patel. Go ahead.
Good afternoon.
Go ahead. My apologies. Go ahead.
Can you hear me?
I can hear you. Go ahead.
Okay, Shirali Patel on behalf of Blaze Responsibly. Just have some quick comments. I wanted to reiterate the request from last time, if the CRC can please convene some sort of town hall forum or just an opportunity where the public in real time can ask questions and have their questions answered. Just a lot of ambiguities with the portal still and rules. And so I think the public would really appreciate a meaningful interaction with the CRC. Of course, we appreciate the public comments and we love that you give us feedback during these public comments, but I think a town hall forum setting in the future would be really appreciated. And I just, as a patient separately, I wanted to bring up an incident just to raise to the CRC. I've been going to a certain ATC for well over a year now and have been using my debit card, which was permitted. And last week I went to a different ATC, and when I requested to pay by debit, I was told that's not an accepted form and that ATCs are not permitted to use debit cards for payments and that it's supposed to be cash only. So I just wanted to raise to the CRC, if you maybe are aware or aren't aware, that there are ATCs that are accepting credit cards and debit cards, and then there's some that aren't. So for the patient's sake, if we can just get some clarity on what approved methods of payment are, so that it's clear. Thank you.
Thank you. Cheryl Murray Powell.
Hi, good afternoon. Hello to the CRC commissioners. My name is Cheryl Murray Powell, Esquire. I'm a cannabis agricultural dietary supplement and trade attorney. I am also the business development manager for CSI, a 45-year screening company. I'm a board member for the Unprescribed, a cannabis and suicide prevention organization focused on the veteran community. And I'm also the ASTM D37 Cannabis Committee's DEI subcommittee chair. I'm really excited about the movement that we're seeing here. Congratulations on the adoption of your bylaws. I was especially encouraged to see the creation of a permitting and licensing subcommittee or committee, which would be focused on aligning with statutory requirements and making recommendations. So I'm very interested in learning more about that committee. I will be reading the bylaws. And again, at CSI, since we are focused on screening and have the only equity verification product, we definitely want to see how the equity verification process adjusts based on these bylaws being adopted. Also really encouraged by seeing the vetting process start with the 2019 RFA submissions or awardees. And I am very pleased with the fact that the testing lab guidance or testing lab regulations were amended based on public comment and public feedback. I think, using Maryland's, which is a very detailed reg, was a great decision. I know people who were involved and worked directly with them in the development of those regs, and the fact that you can make adjustments based on your local community, the needs of your state, and come back with revisions based on public comment and feedback says a lot about the future of the CRC and the direction of the CRC. So I just wanted to highlight those things that I heard today that I'm really happy about. And again, always available to support in any way possible. So thank you guys. Great job, and looking forward to more progress.
Thank you for your comment. The final speaker we have for the afternoon, Madam Chair, is Dr. Monique Hamilton. If Dr. Monique Hamilton is present, please raise your hand. I don't, there she goes. Go ahead.
Hello, can you hear me?
We can hear you.
Hi, my name is Dr. Monique Hamilton, and I'm board certified in internal medicine. I'm the co-founder and lead physician for the Dr. Moni Hammy Medical Center, DMMC, in South Orange, New Jersey. I applaud the New Jersey Cannabis Regulatory Commission in its efforts to develop and enforce programs and regulations for the New Jersey cannabis industry that incorporate social justice and equity. It is imperative that social equity also be applied to medical marijuana. Disadvantaged patients who may benefit from medical cannabis may have difficulty affording it and maintain adequate follow-up with a New Jersey medical cannabis program physician, diminishing the bona fide doctor-patient relationship. Currently, the bona fide relationship is defined as, among other things, the physician has seen and or assessed the patient for the debilitating medical condition on at least 4 visits. It would be helpful if there were a subsidy program available for disadvantaged patients. This will help with making medical cannabis more accessible to New Jersey residents who have had difficulty reaching treatment goals with conventional therapies. I am confident that the CRC will do its best to ensure that patients enrolled in the New Jersey Medical Cannabis Program have adequate access to the cannabis needed to treat their chronic conditions. Thank you. Have a good afternoon.
Thank you. Madam Chair, I see that Chris Ware, whose name was called earlier, is here. So Chris Ware, go ahead. Chris Ware.
Hi, my name is Chris Ware. I'm speaking on behalf of Dazed and Confused LLC. We're looking to submit an application for a dispensary in March. I was curious to find out information further on consumption lounges and the more specific rules and regulations for that, as they're not as clearly defined in the regs so far. They're mentioned, but not really went into. And my other question to the commission was with regards to inside the business for micro businesses, would the consumption lounge be a part of the 2,500 square foot restriction or not? And I think that's about it as of right now. And I was curious to see when we're going to have more of a lead out for the application for dispensaries for the retail. And if there is any information on that, I know you guys did it for the prior ones in December. I was curious to see if there's going to be something similar to that for the one coming up in March. And that's it.
Thank you for your comment. The end of the list, Madam Chair.
Thank you, Ms. Blake, and thank you to everyone who registered to speak. A couple of notes as we get closer to closing out. Based on the comments and questions that were raised here, I do think folks could benefit by going to our website. On the resources tab, there is a webinars link that on that page, you'll find a recording of our pre-application webinar that was from November 30th, 2021. That webinar spells out some of the processes and the timelines that applicants can expect for engaging in the application process. And with respect to municipalities, if that commenter goes to the cannabis businesses page under the recreational cannabis businesses, that under that link on the right hand side, you'll find a 2021 regulatory update and municipal guidance link. That link provides access to the information that the CRC has provided to municipal officials regarding their local licensing systems. The CRC has limited, very, very limited legal authority, and the law does give municipalities some broad authority to set up local licensing systems. But I encourage our viewer who asked about municipal licensing and fees to take a look at the information and the guidance that we did provide to our municipal partners so that we can work together to make sure that we are collectively providing a fertile ground for an equitable landscape as we get our cannabis industry up and running in New Jersey. With that, I believe that concludes all of the items that we have for the cannabis regulatory for today. Do I have a motion to adjourn?
I move to adjourn.
I second.
Moved by Vice Chair Delgado, seconded by, I believe it was Commissioner Nash. Is there any discussion? Hearing none, all those in favor of adjourning, please say aye. Aye.
Aye.
All those opposed say nay. Are there any abstentions? All right, hearing none, the motion passes. Thank you all again for joining today's meeting. Please visit our website to view the full calendar for our regularly scheduled meetings for the year 2022. Our meetings will continue to be conducted virtually until further notice. The time is now 2:48 by my clock, and we are adjourned. I hope everyone has a great rest of the day.